My name is Joel Cancer. I'm in my 30s. I was recently diagnosed with TTP. TTP is a rare blood disorder where your blood can actually clot and not have enough platelets to prevent clotting, so things like internal bleeding. Everything kind of started a week before I went into the emergency department. I had noticed that I played ice hockey and I was having a really hard time keeping up with the play. I was abnormally tired and I just thought, you know, I was maybe a little bit out of shape. It was over the Christmas holidays, so leading up there were still more of those symptoms. I had some weird bruising on my stomach, some rash that broke out, so just really weird symptoms. The morning that I went to the hospital, I woke up and I was actually yellow. My skin was yellow, my eyes were yellow, and I knew that there was something wrong, so I ended up calling telehealth to explain my symptoms to the telehealth nurse. And she said that I needed to go in within the next 4 hours. So I walked into the emergency room. Given the amount of people, wanted to ensure that, you know, I wasn't taking up a lot of time and making sure that resources were being used wisely. So I asked them, okay, can I go home with this or not? And that's when they looked at my symptoms and admitted me into the emergency department, and then I first met Dr. Melanson.
I remember seeing Joel actually, because he was actually quite an interesting medical case. So it was around the Christmas holidays this year. The department was pretty busy, a lot of people coming in to see us, but I remember seeing this young man, and he was kind of experiencing a number of symptoms over the past week. You know, his examination was fairly unremarkable, other than the skin turning a hue of yellow, which again pointed towards maybe some serious problems going on. And so we initially launched a battery of tests to try to figure out what was going on. Didn't take long after some of those tests started coming back to tell us there was something pretty serious going on with Joel's health.
It was kind of a whirlwind. Things happened so quickly that I didn't really get a lot of time to think through it. When I arrived at the hospital, I had driven myself thinking that it would require a blood test. And then Dr. Melanson let me know that I was going to be admitted, which was a whole new thing. And then within 24 hours, I had, you know, had the MRI, I had the CT scan. I think I had over like 40 vials of blood taken. I was on my steroid. And, you know, I had heard about the clot, and then I was transferred to St. John, and then I did my first plasma treatments.
Able to separate, so the cells go back to you that we don't want to discard, and then the plasma gets taken up into the machine. And so what would happen is that the doctor in Moncton, where Joel was first seen, would reach out to our hematologist in St. John, and they would collaborate the care to get him here to have that treatment done. So when he arrived, he would have had to go to the interventional department, the X-ray department, for a special catheter. So we put a very big large bore catheter in the vein in his neck. So after Joel would have had the intravenous put in his neck, he would come back up here and have something called a plasma exchange. This is a centrifuge that will rotate the 5,000 rotations per minute, and it allows the separation of those cells I talked about. And it is the plasma portion that we're trying to get rid of, because it's in the plasma portion that your antibodies are bound, and it's those antibodies with this autoimmune disease, the TTP, that causes the symptoms. So that's the ones that will attack those platelets.
It's my understanding that Joel has made a recovery and that his platelet lines are now back to normal again. He's recovered from that condition. So I'm just really pleased that we were able to kind of really take care of Joel, and I'm just so pleased to hear that he's doing well.
It's a comprehensive sort of job that they do, right? They're there to provide medical attention, but they're also there to help you through the personal side. And, you know, there was definitely a lot of comfort that I received from them, and made it a whole lot easier knowing that I had a great team who not just wanted me to be better healthy, but cared for me as a person.
It's like everybody was amazing from start to finish. Yeah. Every coordination of everything, and just the fact that I'm here and still healthy, right?
Well,
like that's
you're very healthy. Yeah, that's great.
That's awesome. So I really appreciate it.
Hey, no problem. It's great. I'm just so glad you're doing well.